Welcome to today's anatomy lecture. In this video, we'll dive deep into the thoracic wall, the bony structure that protects your heart and lungs, supports breathing, and plays a crucial role in human physiology. We'll cover the sternum, the central bone of the chest, the 12 pairs of ribs, including true, false, and floating ribs, the costal cartilages, essential for flexibility and movement, clinical insights, why the sternum is used for bone marrow biopsies, and how rib fractures can impact the body. Whether you're a medical student, healthcare professional, or just curious about human anatomy, this lecture will give you a clear and practical understanding of the thoracic wall. So let's get started. The thoracic wall is a vital part of the human body, providing protection to the heart and lungs while supporting breathing. It consists of three main components: the sternum, breastbone, the ribs, 12 pairs, the costal cartilages, connecting ribs to the sternum. The sternum. The sternum is a flat bone located at the center of the chest. It is divided into three parts. One, manubrium, articulates with the clavicles, collarbones, the first and second costal cartilages, the body of the sternum at the manubriosternal joint. Sternal angle of Lewis, an important anatomical landmark located where the manubrium meets the body of the sternum, lies at the level of the second costal cartilage, helpful for counting ribs, the fourth to fifth thoracic vertebral disc, the junction of the ascending aorta and aortic arch, the bifurcation splitting of the trachea into two bronchi, the boundary between the superior and inferior mediastinum. 2. Body of the sternum, articulates with the manubrium above, the xiphoid process below, the second to seventh costal cartilages on each side. 3. Xiphoid process is a thin plate of cartilage that becomes bone in adulthood. No ribs or costal cartilages attached to it. The ribs. There are 12 pairs of ribs, all of which attach posteriorly to the thoracic vertebrae. Types of ribs. True ribs, 1 to 7 directly attached to the sternum via their own costal cartilages. False ribs, 8 to 10 indirectly attached to the sternum by connecting to the 7th rib's cartilage. Floating ribs, 11 to 12 no anterior attachment. They end freely in the abdominal muscles. Typical rib structure. A long, twisted flat bone with head. Has two facets that articulate with the vertebrae. Neck connects the head to the tubercle. Tubercle articulates with the transverse process of the vertebra. Shaft, the main curved part of the rib. Angle, the point where the shaft bends forward. Costal groove, houses the intercostal vessels and nerves. Atypical rib, the first rib, small and flattened compared to other ribs. Clinically important due to its close relationship with the brachial plexus, nerve network controlling the arm. The subclavian artery and vein, major blood vessels. The scalenus anterior muscle attaches to its surface, dividing the subclavian vein in front and the subclavian artery behind. Costal cartilages. Function. These bars of cartilage connect the ribs to the sternum, providing flexibility to the rib cage. Attachment. Ribs 1 to 7 attach directly to the sternum. Ribs 8 to 10 attach to the rib above them via cartilage. Ribs 11 to 12 do not attach to the sternum, ending in the abdominal muscles. Cervical rib and thoracic outlet syndrome. A cervical rib is an extra rib that occurs in about 0.5% of people. It arises from the 7th cervical vertebra and may be freestanding, not connected to anything. Attached to the first rib via a fibrous band, articulate with the first rib, form a joint, can compress nerves and blood vessels, leading to thoracic outlet syndrome. Symptoms include pain, numbness, and weakness in the arm due to pressure on the brachial plexus or subclavian artery. The thoracic wall plays a vital role in protecting organs, assisting in breathing, and providing structural support. Understanding its bones, articulations, and clinical relevance is essential for medical professionals and students alike.